becomes a wrong technique of breastfeeding. Usually the wrong latching techniques, everything cause a reduction in breastfeeding. Then use of oral contraceptives should be thought of in later ages. Then certain psychiatric diseases which are happening to the lady, let's say postpartum blues and all, which is preventing the lady from the interest in lactating or the baby care. It's usually now the prevalence is rising up. So should think of that also. If the lady is interested in breastfeeding, because she's, if it's a primipara, she's not used with that procedure. So someone should be there. It's a duty of the doctor to promote the breastfeeding. She will be, maybe someone will be shy enough. So promoting breastfeeding or giving an emotional support for breastfeeding also enough. It should be done. And early introduction to bottle feeds and pacifiers should be strictly curtailed. So coming to our Ayurvedic platform, we advise the care of breast even from the pregnancy time itself. We advise that Edannapanam Prayena Garpini Nisheveda, it is divided into 3 types. One is gone for the nutrition of the baby. The one part is go for the nutrition of the placenta. Other 1/3 give the nutrition for the breast. So that breast care starts from the first month of pregnancy as well. It's not a thing to be thought of while you are going to lactate. So many of the drugs indicated in the pregnancy care is actually targeting the development of lactiferous ducts and also the maturity of the alveoli. Many of the drugs coming in the 8th and 9th month is Shatavari, which is a proven galactogogue, and in Arabia Kalpandrupa, that is the traditional Kerala special pediatric textbook. In Arogya Kalpadrama, it is advised to give a Kshira Kashaya with Shadavari, Jiraka, Bela, that is Bela Mula and Nagara, which is very effective in preparing the breast for that healthy lactiferous duct tubes. And it has been a tradition in Kerala to give this Shadavari, Bela, Kshira Kashaya. Shadavari and Bela are taken in higher amounts, and we add a very bit of Jira and Nagara to that. And Kshira Kashaya is prepared. And it has been a research study was being conducted by on this Shadavari Bela Kshira Kashaya by our late Shyamala Madam of Prasuti Tantra department. And it has shown that this Shatavari Bela Kshira Kashaya is working in a different axis. Like apart from that breast development, it is going to increase the neuronal development of the babies as well. So the mothers who had consumed that Kshira Kashayam had babies with a higher head circumference, and the babies were having good neuronal axis or neuronal development. That neurodevelopmental index was higher than the other parallel age group who were not fed on the Shadavari Bela Kshira Kashaya. That shows the effectiveness of the Kashaya in increasing the breastfeeding and also increasing that neuronal axis as well. So when the neurodevelopmental axis of the babies are increased, babies will be having a good suckling reflex as well. The neonatal reflex will be very nice, so it will be enabling the baby to suck well. Next, coming to drugs which are proven to improve that milk secretion. That one is the common methika which we use, fenugreek or methika. It's a custom in Kerala to prepare kashaya or a porridge with methika. Methika or fenugreek is having the thicker rasa and ushnavirya, and it is research studies has proven that it stimulates the initiation and also maintenance of breast milk by acting in a prolactin secreting pathway. And also the estrogenic compounds in phytoestrogenic compounds in methika is going to increase the secretion of breast milk within 72 hours. That is within 3 days. So it's a custom in our place. We call it as methika yavaku. It's a custom in Kerala to feed that lactating ladies with yavaku that is prepared with rice and a very rich amount of methika in that. Though it is not that palatable or tasty, but it's a customary and it's proven to increase the quantity of breast milk. This is the methika shirayavagu recipe, which we practice it regularly. So raw rice is taken, a quarter cup, and fenugreek seeds 2 tablespoons, and a bit of garlic is added to that. Cumin seeds, again galactogog. Garlic is also another galactogog. Is added to that and made, the yavagu is prepared out of that. And to compensate that bitter taste of fenugreek seeds, we add a bit of coconut milk and a jaggery to make it palatable. So it's after this methika shirayavagu is actually a palatable preparation. And that bitter taste of methika is hindered by the effect of the palatability of coconut milk and also jaggery. Again, Kshirinya Aushada is again galactogog. So natural coconut milk is again having that galactogog property. So apart from that, all the ingredients of this methika shirayavagu are having galactogog effects. So this fenugreek seeds, garlic, cumin, and this coconut milk, then are added with jaggery. It's a nutritious and also a very healthy galactogog mix. Another thing to be given to the lactating lady is this drumstick leaves or shigru leaves. The shigru is told to be stanya shodhana and also having a stanya varthana property. This dual compound properties in single drug is to be thought of ties. So this, even though it is kadu, tikta, and having shida property, it is stanya shodhana as well as stanya varthana as well. So again, including these shigru leaves in is also another customary fashion, custom in our tradition. That is this shigru patra or or drumstick leaves are fried in ghee and added a bit of salt, and it's taken in the form of soup. Even it is used as dry curries as well. That's roasted, a bit roasted in ghee. It's not intensely cooked to dry off that water, and semi-salted in ghee. Again, research studies on this Moringa oleifera, that is shigru leaves, has proved the efficacy of the shigru in increasing the breast milk production in postpartum ladies. Next comes shatavari. Shatavari is a well-known galactogog, and palatability is also nice. So it can be used as Shira Kashaya very well. As I told earlier, to use Shira Kashaya with shatavari even before delivery as well. So asparagus racemosus, due to its Snikta Guru Madhura and Shida Guna, it can balance the Tridosha as well. Again, research studies to prove the efficacy of shatavari as a galactogog. And another traditional custom in Kerala, which I like to share with you, is our traditional Vedukuli. Vedukuli is a type of snana given to the lactating lady or the lady soon after delivery to improve their lactation skills. So it is a Ushna Snana with Kashaya, or we can call it as a Snana in Kashaya thread. This Nalpamara, that is Nalpamara Twak is taken, and the Kashaya is prepared the day before itself, and it's well heated to give an Ushna Snana or Ushnodaka Snana for these ladies during the lactating time. And Svedana is done with the, for the breast also, which ensure very good lactation process, and this breast engorgement, everything is usually usually managed well with this local Svedana done with this Shiraviksha Kashaya. And while the ladies are given bath with the body bath, this hot hot Nalpamara, or we call it as Shiraviksha Kashaya. Nalpamara means 4 Shiravikshas, or Shiraviksha Kashaya. We're giving bath and hot water bath with the body with Shira Kashaya. At the same time, we give a cold water bath on the head with Amalaki Kashaya. So can you think of a lady given bath, hot water bath for the body, and at the same time cold water bath, or Anushna Jala is given head bath. So this contrast is proven to improve that lactation. We can see the ladies ejecting out an enormous amount of breast milk even during that snana procedure, bath procedure itself. So it's also a routine custom in Kerala tradition that we call it as Veda. Veda means that the medicated leaves which we add in that. That is called Veda Kuli. So many exploring the ancient texts regarding this lactation. Many Kerala special pediatric textbooks are available. So many Stanya Varthaga or Galactagogue preparations are there, especially regarding this Prishnaparni, Shaliparni, Yashti Madhu. Then many preparations adding coconut milk in that. Then green gram, rice and all. Masha again prepared in Shireva consistency. And Jivanti used widely because Jivanti is a proven galactagogue. Jivanti, Shigruli used widely. Jivanti, Musta, Amalaki, Swarasa, everything used. And even Shastika Shali is also given to the lady for improving the lactate. And the chance of Sanavidradi is thought of because the engorgement of breast is very common. So, it Sanavidradi, there are many portalies to be applied on Ubanaha Svedam, which is applied to be applied on the breast to tide over that engorgement of the breast. So, it is like a combination of Haridra, Nimbapatra, and Saindava to be externally applied on the breast, or even you can think of Krishna Tila, which is cooked in, very well cooked in milk, made into a paste and mixed with Eranda Bija, Eshti Madhu and Trubala, again made into a paste, medicated paste, and to be applied on the breast. Very effectively, we use it in clinical practice also for mastitis and breast engorgement. That is Tila Taila, Tila, that's Krishna Tila seeds cooked in milk, and it's to be mixed with Tribala Churna, Eranda Bija, and Eshti Churna. This compo, we use it regularly in clinical practice. And nipple cracks, Shadadauda Krida, after the Shalanam with Varakashaya is usually used regularly. Because Shadadauda Krida doesn't have any side effects if consumed by the baby as well. So after Shalanam with Varakashaya, we give an enormous amount of Shadadauda Krida as a paste. Or even cracked nipples, we can think of syringing techniques, that is cutting along that line of this normal syringe, that is 10 to 20 ml syringe. Then inserting the piston from the cut end, otherwise, so that the smooth syringe end will be can be attached to the breast, and you can mother can gently pull the piston out, so it can help in expressing the breast milk. So in maternal illness, what to do? If the lady is suffering from cancer, can the lady breastfeed? Sure, the breastfeeding should be advised in the lady even if she is having any type of CA. Unless and until if the lady is on any radioactive components which is used for cancer diagnosis, it has a possibility to get seep out through the milk. So it should be curtailed in case of radioactive components. Otherwise, she can regularly breastfeed the feed the baby. And if any radiation or process, the treatment of CA is like radiation is causing breast, that shrinkage of breast ducts also, atrophy or lobules also, you should think of other feeds. Otherwise, if she is lactating, we are supposed to breastfeed the baby. And next, coming to endocrinal diseases, whether to lactation should be advised in ladies with severe uncontrolled diabetes mellitus. Sure. Again, uncontrolled diabetes mellitus, even if it's uncontrolled type 1 or type 2 diabetes, baby can breastfeed, lady can breastfeed the baby. Maybe this, and again, this breastfeeding is having a protective effect, and it helps in the amount of insulin the lady may need. So it is an again this breastfeeding is having a protective effect on diabetes mellitus for the lady, and no harm for the baby as such. So it is advised in CA, it is advised in diabetes mellitus, it's advised and in thyroid disease. Thyroid disorders are notorious to reduce that milk production. So hypothyroidism, usually the milk secretion in mothers will be reduced. So we should treat the thyroid hypothyroidism well enough so that her with thyroid supplements or any Kapahara treatment, so that she's having a good amount of breast milk to supply that lady. Now coming to the present scenario is like COVID scenario for the last 2-3 years. So there is no proof that COVID is having a very 100% vertical transmission. So if the lady is an active COVID phase, it's better to use a mask to prevent that spread through the droplet infection, and to advise the lady to breastfeed, because breastfeeding is not, if the infants are having a very low risk of this COVID infections, and again that antibodies from the mother is going to give a protection for the baby as well. So if the lady is given on a mask or a good N95 mask or a good protection, it is advised, let her feed the baby. And intense roaming in is not that advised, but let the lady feed the baby. That's advised with enough infection prevention protocols. It's advised to feed the baby. And even if the baby is going to get the COVID, infection will be very mild. So chance of infection to give into severe phases are very rare in COVID cases. So our hospital at Government Ayurveda College Trivandrum was working as a COVID maternity care hospital for more than 1 year. So we had more than 156 COVID deliveries in our hospital. And we were advising a protocol, and among these 156 COVID deliveries, we had only 2 cases of 2 babies who had suffered from COVID infestation, and that too, it was very mild. So with enough precautions like mask and all, we were advising the ladies to feed the baby. And other infectious diseases like tuberculosis, whether the active TB phase, mother should feed the baby. If the mother is having an active TB, the sputum positive for Mycobacterium tuberculosis, so the baby is having every chance to have that through that droplet infection. So there are two streams of thought, that to keep the baby away and not to give the breast milk. And the other thought is, let the baby receive that isoniazid and let the mother receive the therapy to convert her into sputum negative, and let them feed. So that's another thought. But the other stream is that keeping the baby away and curtailing that breastfeeding. So again, it's a controversial area whether to breastfeed an active TB cases alone who are having sputum positive. In the other stream, breastfeeding is advised, and isoniazid is given for the baby as well, for increased chance of getting that infection. So if the mother is sputum negative, there is no question as well. It's always advised to breastfeed the baby. Then hepatitis B. So hepatitis B virus is transmitted by human milk in mothers who are positive, but usually breast milk infants are given hepatitis B vaccine, and along with hepatitis B, immunoglobulin. And so immunoglobulin is going to give a protection against that. And mothers are usually allowed to breastfeed if we are providing with hepatitis B, immunoglobulin, and vaccine. So again, that's the case of hepatitis B. Now in active HIV cases. Active HIV cases, this HIV virus has been isolated in breast milk. So child to mother transfer is high in the vertical transmission. Usually through the placenta itself, child might have got the infection. If the child is not the baby is not uninfected, so it's better to curtail. If the baby is safe, better to curtail feeding the baby. But now the recent study is that due to that high incidence of undernutrition in babies, so even our governmental papers have come with a view that feeding the baby is better than leaving the baby to die with undernutrition. So it's a different thought, like even in active case of HIV, you can feed the baby. Usually in severe active case of HIV, vertical transmission might have occurred. So if not, if the lady and baby is in safe hands, it's better you can restrict the breastfeeding in active cases and supplement the baby with breast milk from the breast milk banking of other ladies which are who are healthy. That is, supplementing the breast milk with other ladies' breast milk is a bit more good option if both the mother and baby are well supported. But in neglected areas of undernutrition and all, it's advised to feed the baby. Then chicken pox. Coming to chicken pox, if the lady is infected with this chicken pox within like recent infestation within 1 week of delivery, and baby is experts recommend that mother and baby be separated to minimize the chance of infection. That's the only condition when the mother and baby is to be separated. So if the baby is not infected, better to separate the baby. Then concern with cholera and typhoid fever, no chance of transmission through breast milk. So this bifidus factor, everything, and giving a protection for this typhoid fever as well. So exclusive breastfeeding is advised and mandatory in cholera, even if the lady is suffering from cholera and typhoid. Similar is the case of hepatitis A as well. So to summarize that, mastitis and breast abscess, if the lady is having severe mastitis, better to pump out that pus, and the breast milk will be having a very pungent or sour taste, so babies won't be accepting that breast milk. So if the baby is accepting that breast milk, pump out that pus from that abscess, drain it out, and then the remaining breast milk can be fed. It's not a contraindication for breastfeeding. Active tuberculosis, and as active tuberculosis we have discussed earlier, then UTI infections, you should breastfeed, continue breastfeeding. Bacterial infections, breastfeeding to be continued. Diarrhea, breastfeeding to be continued. Malaria, breastfeeding to be continued. Candidal vaginitis, breastfeeding should be continued with proper hygiene. And other viral infections, it's better to continue breastfeeding with proper precautions. So, after discussing all this topic, we are coming to the end of the presentation, because promote healthy breastfeeding by incorporating the useful and safe aspects from the tradition as well. And let us help the ladies to breastfeeding during the working hours as well. Let it work effectively. So it is Ayurveda is not only for exclusive breastfeeding, we are for exclusive breastfeeding that is more healthier. We are also for Shuddha Stanya as well. So keeping the quantity, quality, and healthy exclusive breastfeeding is our motto. And thank you all. And once again, I thank the organizers for inviting me to share my views regarding that breastfeeding. Hope I could share some traditional views. you.
Thank you, ma'am. Thank you, Roshni, ma'am. Can we take question answers? Is anyone ready?